Fear of blood and needles is the only phobia that can make a child actually faint. About 70% of people with it report fainting. If you're a parent who's ever watched your kid completely lose consciousness right before or even during a simple vaccination, well, you know exactly how terrifying that moment can be. But here's the really incredible thing we're going to explore in today's explainer. That faint, it's not a behavioral issue. It is a fascinating biological response. And even better, there's a science-backed physical superpower you can teach your child to stop it in its tracks. Let's dive right into demystifying blood injury injection phobia, or BII for short, and see what's actually happening inside a child's body.
70%. I mean, just think about that for a second. That is a massive number of people with severe blood and needle fear who actually experience fainting. And this high fainting rate makes blood injury injection phobia a complete physiological anomaly compared to literally any other anxiety disorder out there. Think about it. If someone's terrified of spiders or heights or dogs, their body goes into overdrive, right? They might panic, start sweating, try to run away, but they don't pass out. BII phobia is entirely unique in the medical world because it triggers a physical chain reaction that flips the body's internal switches in a completely different way.
Section 1. The fainting phobia anomaly. A biological reflex. The absolute most crucial reassurance for you as parents is that this isn't bad behavior. It's not them being dramatic, and it's certainly not a sign of weakness. What's happening is their nervous system is executing a highly unusual, hardwired program called a diphasic body response, which is really just a medical way of saying it's a two-part reaction. When a kid with this phobia anticipates a medical procedure, phase 1 kicks in. This is your standard anxious spike. The sympathetic nervous system fires up, fight or flight activates, and their heart rate and blood pressure shoot right up. But then, bizarrely, phase 2 takes over. The body suddenly slams on the brakes. The parasympathetic nervous system overreacts, causing this rapid, extreme crash in both heart rate and blood pressure. And it's that phase 2 crash that directly causes something called vasovagal syncope. Because the blood pressure drops so sharply, blood actually drains away from the brain. The brain realizes, uh-oh, I'm not getting enough oxygen, and it essentially pulls the plug to reboot the system. It forces the child to fall down so that gravity can help restore blood flow to the head. It's wild to think about, but the child's brain is literally forcing a physical shutdown. Understanding this completely changes how we manage the fear, because we aren't just fighting an emotion anymore. We have to fight a physical drop in blood pressure. Section 2. Roots in early childhood, where fear begins. So when does this neurological wiring actually take root? Well, the research highlights that a full 25% of adults with severe needle fear trace it directly back to their childhood. That's a massive quarter of the adult population suffering from this phobia who acquired it when they were kids. And honestly, it proves exactly why early parental intervention matters so much. A traumatic, poorly managed medical procedure in childhood doesn't just, stay in childhood. It can set a precedent that leads to a whole lifetime of medical avoidance. Tracing this pathway, we see that in early childhood, kids undergo the highest concentration of vaccine injections. And historically, these really common painful procedures were often done without any pain management at all. This unmitigated pain acts as a precipitating event. By the time kids hit ages 5 to 10, we see the peak age of needle fear onset. The pain and the fear just escalate together. If it's left unmanaged, this pathway leads straight into adulthood, where we start seeing chronic avoidance of medical care. People will literally skip vital blood tests, delay surgeries, or refuse vaccinations simply because the phobia has become so overwhelming.
Section 3. The Applied Tension Technique. Stopping the faint.
Okay, here's where we pivot to the practical toolkit, and I am so enthusiastic to share this with you. It's called the Applied Tension Technique. Because we know that fainting is caused by a massive drop in blood pressure, science gives us this distinct superpower parents can use to abort the faint before it even starts. Now, standard anxiety treatments usually tell you to relax and take deep breaths, right? Well, applied tension asks you to do the exact opposite. Because relaxing actually lowers blood pressure, it makes the fainting response worse. No way, right? Instead, applied tension physically forces the blood pressure to stay elevated, effectively short-circuiting that vasovagal crash we talked about earlier. So, how do we actually do it? Let's coach through these exact 3 steps right now so your child could practice it in the waiting room right before their next blood draw. Step 1. Have your child tense the large skeletal muscles in their arms, their legs, and their torso. Think of it like flexing like a superhero. Step 2. They need to hold that tension for about 10 to 15 seconds, or until they literally feel their face getting warm. That warmth? That is the blood pressure rising. Step 3. Release the tension slightly, but crucially, don't relax fully. Wait about 20 to 30 seconds and then repeat the cycle. If they start doing this as soon as they feel those early signs of lightheadedness or right before the needle comes out, they can physically block the faint.
Section 4. Exposure and breathing coping. Managing the anxiety.
Now, while applied tension manages the physical faint, the gold standard for the psychological fear is pairing it with graduated in vivo exposure to tackle the anxiety before the needle even appears. This just means slowly, step by step, building up their tolerance to medical settings. You might start by just looking at a picture of a doctor's office, then maybe a picture of a needle, then playing with a toy medical kit, and finally visiting the actual clinic. Alongside this, we use comfort positioning, like having the child sit upright in your lap rather than lying flat, and utilizing high-level distraction techniques during the actual poke. And I really want to clarify an absolutely crucial nuance about breathing-based coping here. When kids get scared of a needle, their first instinct is often to hold their breath, bear down, and squeeze their eyes shut. In medicine, this is called a Valsalva maneuver, and it is highly unhelpful because holding your breath actually reduces cerebral blood flow and can trigger the faint. So while we want them to flex their muscles, we must actively coach them to maintain normal frequency breathing. Breathe in, breathe out, keep it steady, all while keeping those leg and arm muscles flexed. Section 5. When to seek help. Clinical boundaries.
It's so empowering to know how much you can do at home, but as parents, while you're absolutely their best advocate, you should never attempt to formally diagnose a severe phobia yourself. If your child's fear is resulting in persistent, impairing avoidance of necessary medical care, if they're having panic attacks, missing required immunizations, or the distress is just completely unmanageable, it is time to seek professional support. Cognitive behavioral therapy, delivered by a specialist, is highly effective for BII phobia and can safely guide a child through these exposure steps in a controlled, supportive environment.
So, the crucial point we've learned today is that biology doesn't have to be destiny. If a simple muscle flex can stop a faint, just imagine how else we can empower kids to master their medical anxiety and take control of their own health journey. Fear Me Not helps kids conquer fears through play.